My name is William Abraham. I'm Director of the Division of Cardiovascular Medicine at The Ohio State University and a specialist in congestive heart failure. I've been involved with studies of implantable hemodynamic monitoring, including CardioMEMs wireless pulmonary artery pressure monitoring system, specifically as the co-principal investigator of the CHAMPION trial. The CHAMPION trial was a large 550-patient randomized single-blind study that evaluated the utility of wireless pulmonary artery pressure monitoring in heart failure patients. The primary endpoint was heart failure hospitalization, and the study showed a highly significant reduction in the risk of heart failure hospitalization at both 6 months and over the full duration of follow-up, which averaged 15 months and ranged to as long as 30 years. This reduction in heart failure hospitalization is clinically meaningful at a 37% relative risk reduction over the full duration of study follow-up. The efficacy of implantable hemodynamic monitoring is based on the notion that the proximate cause of worsening heart failure symptoms and hospitalization is an increase in intracardiac or pulmonary artery pressures. Our current means for monitoring heart failure patients try to estimate changes in those pressures through, for example, monitoring of changes in daily weight. However, the sensitivity for daily weight change in predicting a heart failure hospitalization is only about 20%. So our current tools are imprecise. The direct measurement of pressure is very precise, and this allows us to better manage patients and keep them out of the hospital. At the present time, the patients who are likely to benefit most from wireless pulmonary artery pressure monitoring are Class 3 patients who have a history of heart failure hospitalization within the past year. That is, the high-risk patient for heart failure hospitalization. That being said, I suspect that future studies may evaluate the utility of this approach in patients with less severe heart failure, where perhaps the goal may be to attenuate the development of a first heart failure hospitalization rather than to prevent recurrent hospitalizations. Yes, if this technology were adopted in practice tomorrow, I think the major barrier to its utilization is simply helping people understand how the information can be used. The good news is the technology is very straightforward. This sensor is wireless, it has no battery, and it has no moving parts. So there's nothing to wear out, there's nothing to run out, and there's really nothing to break. And sensor reliability has been excellent. We've seen no sensor failures in more than 600 patients included in studies. That being said, it does take a while before clinicians appreciate the best way to use the system. But it really is quite simple. We manage pressures the same way we currently manage changes in daily weight or patient symptoms. We simply titrate medications up or down to optimize pulmonary artery pressures and to lower the risk of hospitalization in our heart failure patients. Yeah, the CardioMEMs pulmonary artery pressure monitoring sensor can be implanted by a variety of cardiovascular subspecialists, as it requires only basic right heart catheterization skills to implant. In the CHAMPION trial, interventionalists, electrophysiologists, heart failure specialists, and general cardiologists all implanted the device and all managed the information provided by the device, thus demonstrating the broad applicability across cardiovascular subspecialties. Yeah, my understanding is that there is a reimbursement code for this, although I can't really quote the reimbursement. I don't know it for sure. Yeah, I believe hospitalization as a primary endpoint in this trial is sufficient to drive clinical utilization of the sensor. In fact, we saw in the CHAMPION trial, despite the fact that it wasn't adequately sized or powered for mortality alone, a trend towards a reduction in mortality. Perhaps in the future we'll see some trials done in the post-marketing setting to confirm that. But really our major goal in heart failure management is to help patients feel better and to keep them out of the hospital. And in this regard, the CHAMPION trial not only showed a marked reduction in heart failure hospitalization, but also a significant improvement in quality of life of the patients randomized to the treatment arm. Sure. So with technology, there is always a potential for too much information, and that's why the approach developed around the CardioMEMs pulmonary artery pressure sensor has been kept very simple. The patient simply makes a measurement of pressure on a daily basis. The goal is to lower elevated pressures into the normal range if possible, and if the pressures rise, to lower them again. So it's very similar to what we already do using more imprecise or crude measures of heart failure clinical status, such as change in symptoms or daily weights. But in this case, we're using a more precise measure that has clearly been shown in the CHAMPION trial to have a major impact on heart failure hospitalizations. Yeah, there are additional data being presented in other meetings. There is a symposium being held at the TCT to present some additional data. As we've done additional analyses of the CHAMPION trial, one of our goals has been to understand better the medication changes that seem to result in the best improvement in pulmonary artery pressures. And one of the things that we found is that while diuretic changes, both increases and decreases in diuretic doses, help optimize pulmonary artery pressures, vasodilators play a significant role as well. And so the initiation or uptitration of drugs such as nitrates may also see a resurgence in this era of implantable hemodynamic monitoring.